We're choosing to use a One Health approach to addressing this very complex societal issue. Now, what is One Health? One Health is a global now and internationally embraced principle that says if you want to achieve healthy outcomes for individuals and communities, that you can't just look at humans in isolation of animals in their lives or in the environment, and the environment is itself. That these three, humans, animals, and the environment, are all integrated and interface in ways that can either promote health or not. It says that when we look at the fine work that's been done over the decades for pets, for animals, largely it's by communities that are focused only on the pet, whether they are animal welfare organizations or veterinary service providers. That part of our community is not structured to look at the family and the family's reality. Yet the family is critical because the pets rely on the family for everything. It's a dependent relationship. So we are partnering with new professionals in new ways, those being social service and public health. Now these two entities, those communities, exist to support families, but their programs, their policies were built without factoring in the presence of non-human members. And why do we put it that way? It's because most people report their pets as being family to them, and they behave that way throughout society. So our desire is to see these programs that traditionally existed to support families to also start to make decisions now with the non-human member in mind. Likewise, our providers need to become comfortable working within a system whereby the family's needs are being addressed through other means. That's the One Health approach. And of course, the environment, we like to think their ecosystem is defined largely by low socioeconomics. And we're largely talking about working people now, the working poor, not slackers, as some would say it. So low socioeconomics is the environment in which we're trying to achieve healthier outcomes for the animals. But in order to do that, we got to take into consideration what's going on with the families that they're in.